So first we're going to talk about the central ossifying fibroma, and this is composed of fibroblastic stroma, or connective tissue, in which foci of mineralized products are formed. And ossifying is referring to this sort of bony tissue, and the mineralized products you can see in this image here. We have this basically radiolucent lesion, but it contains this radiopaque little specks of ossification mineralized products that are at the center of this lesion. Now, if you watched my last video on odontogenic tumors, we talked about central odontogenic fibroma and the peripheral version, and the same theme is here. The same theme in that central is referring to the lesion occurring in bone. In this case, it's going to be a well-circumscribed radiolucency with this ossification byproduct, this ossification product in the center, and peripheral, meaning that's occurring in the gum tissue. And you're not going to see this iconic radiolucent appearance. There's also a juvenile version of it, and this is an aggressive variant with rapid growth, and of course, since it's called juvenile, affecting a younger patient population. Now, it's similar in appearance and behavior to the cementifying fibroma, which is an odontogenic tumor, and honestly, it's probably not too important to remember that fact for the exam. Treatment, as in a lot of the lesions we've been talking about lately, is with surgical excision. Next, we have fibrous dysplasia, and the most important term to remember for this one is it having a ground glass appearance. So ground glass is, well, one way to remember it, at least I remember it, is I remember the word fiberglass, and fiberglass to me reminds me of fibrous dysplasia and this ground glass appearance. So I link fibrous and glass together. That's, again, very important to remember that. And it usually stops growing after puberty, but before then it can be very expansile and cause some facial distortions. And you can see how big they can get in this image here. And this ground glass appearance is like this very soft kind of radiopaque appearance throughout the entire lesion. We have another syndrome here. This is McCune-Albright syndrome, and it has a polyostotic, which means it affects more than one bone, of fibrous dysplasia, plus cutaneous café au lait spots, which are basically these certain type of freckles, plus endocrine abnormalities like precocious puberty occurring a little earlier. So that's a syndrome that I would know for the exam, and treatment for fibrous dysplasia would be surgical recontouring for cosmetics. And you probably practically want to wait until after puberty when this lesion stops growing, so you know you won't get a significant amount of recurrence undoing your surgical work. Next, we have another very commonly tested one, periapical cemento-osseous dysplasia, or PCOD for short. This one is a reactive process of unknown origin, and it's by far most common at the apices of mandibular anterior teeth, as seen in this image here. And it's also most common in middle-aged Black females. And that is also a very commonly tested fact. Teeth here, even though they may look like the pulps are necrotic, because why are there these lesions at the apex, centered around the apex? You'd think it's some sort of infection, but this is actually, again, a reactive process of unknown origin, and the teeth, if you were to test them, are actually vital. So that's a really important fact to know to differentiate something that may look like an endodontic or periodontal infection, and it's actually just PCOD that looks like it could be something a lot worse. When you have this lesion, it actually starts out looking more radiolucent, and it becomes a little bit more radiopaque with this sort of radiolucent border around it, like you see in this image here. And the treatment here is actually nothing, just to monitor it. Next, we have the osteoblastoma, and this is a circumscribed, opaque mass of bone and osteoblasts. So you can imagine if we're talking about mineralized tissue, it's going to appear radiopaque. And the treatment here is surgical excision.